Fear of flying, also known as aviophobia or aerophobia, is a common anxiety disorder where individuals experience significant distress and avoidance of air travel. While some fear plane crashes, others may be afraid of turbulence, being trapped in a small space, claustrophobia, or a loss of control. The psychology of fear of flying involves a complex interplay of cognitive, emotional, and behavioral factors, often fueled by irrational fears and a tendency to overestimate risks. Here's a more detailed look at the psychology of fear of flying. Cognitive factors. Overestimation of risk. People with fear of flying often overestimate the probability of crashes and other negative outcomes, despite the statistically low risk of air travel. Cognitive distortions. This can involve catastrophizing, imagining the worst-case scenario, or all-or-nothing thinking, assuming a plane crash is inevitable. Confirmation bias. Individuals may selectively focus on and remember negative experiences or news stories about plane crashes, reinforcing their fear. Emotional reasoning. The tendency to use anxious feelings as evidence of danger, even when there's no objective basis for fear. Emotional factors. Anticipatory anxiety. The anticipation of flying can trigger intense anxiety and panic, even before the flight itself. Panic disorder. Some individuals with fear of flying may be more prone to panic attacks, fearing they might experience a panic attack while on a plane. Claustrophobia. A fear of enclosed spaces can exacerbate fear of flying, particularly the cramped environment of a plane. Loss of control. The feeling of being in a situation where they have no control over the environment can be a source of anxiety. Behavioral factors. Avoidance. Individuals with fear of flying may avoid air travel altogether, limiting their ability to travel for work, leisure, or family visits. Reliance on medications or alcohol. Some individuals may use medication or alcohol to cope with their anxiety, which can be a temporary solution, but does not address the underlying fear. Desensitization and exposure. Therapy. Gradually exposing individuals to flying in a safe and controlled environment can help them overcome their fear. Contributing factors. Past experiences. Negative experiences with flying, witnessing air accidents, or learning about them from others can contribute to the fear of flying. Personality traits. Individuals who are generally anxious, prone to catastrophizing, or have difficulty coping with uncertainty may be more susceptible to fear of flying. Traumatic experiences. Traumatic experiences such as a past accident or a stressful event related to flying can trigger or worsen the fear of flying.